Hi, I'm your host, Amy Freena. For over 30 years, CareCredit has been enabling people just like you to get the care, procedure, or surgery they want or need when they want it. Behind the thousands of amazing testimonials we receive from our cardholders are the dedicated providers and healthcare workers who make these stories possible. In this series, we are giving you exclusive access to these well-respected and renowned care experts who are all part of our CareCredit network and asking them to share the information and answers you need to make informed decisions about your health, wellness, and personal care. I would like to introduce you to Dr. Thomas Taylor, who is going to be telling us all about facelifts. Dr. Taylor is a plastic and reconstructive surgeon with a private practice in Pasadena, California. He received his medical degree from Columbia University and completed his residency at UCLA Medical Center. He's not only board certified in plastic surgery, but is also a fellow of the American College of Surgeons. Dr. Taylor's surgical achievements have been featured in several local and national media outlets. In this episode, let's listen as Dr. Taylor talks candidly about facelifts and shares what you need to know to decide if this surgery is right for you. Hi, I'm Amy, and we are joining you live from the studio today with Dr. Taylor, who is going to give us some insight on facelifts. How are you today, Doctor?
I'm fine. I'm very happy to be here.
Well, we're happy to have you.
Thank you.
So before we get into facelifts, we kind of want to get to know you a little bit, so I'm going to ask you some questions about yourself, if that's all right with you.
Sure thing.
Okay, so if you couldn't be a plastic surgeon, what would you be?
I would consider being a photographer in the field of maybe nature, landscape, wildlife, something like that. It's a passion, a hobby of mine.
Absolutely. What about your favorite food?
Japanese.
Yum.
For sure. I try to eat healthy, and I love fish, and I just love sushi and everything about Japanese culture, their foods, their mindset about life. But yeah, I love Japanese food.
All right. Well, you are making me hungry, but we're going to move on. Okay. What about your favorite thing to do on your day off?
Well, on my day off, I like to relax, but my idea of relaxing is probably different than a lot of people's day of relaxation.
Okay.
I participate in competitive swimming.
Okay.
So I work out 6 days a week. I'm a member of the Rose Bowl Aquatic Center Masters program here in Pasadena.
Very cool.
And we compete nationally and internationally.
Wow.
And so typically on my day off from work is when I train more. And we do not only swimming, but we do a lot of dry land exercise as well.
Wow.
And throw in a nap in there somewhere, which I
course.
look forward to. My Saturday morning naps are something I really covet. But yeah, it's a big part of my life right now.
Awesome. Very cool. Well, before we get into all the questions about facelifts, can you tell us a little bit about your educational background?
Yes, I'm from Boston. I grew up in New England, and I went to Dartmouth College in New Hampshire, and then I went down to New York City to Columbia for medical school. And then I matched out here in LA at UCLA for my general surgery residency. Enjoyed Los Angeles, got married, had kids, chose to stay here for my plastic surgery training, which I did at USC. And then here I am, private practice in Pasadena, California.
Wonderful. All right. Well, let's get into the meat and potatoes here. We want to find out a little bit about facelifts. So first and foremost, what is it and why would someone seek out this procedure?
Well, there are a lot of reasons that people don't feel good about themselves, whether it's aging, whether it's a specific blemish on their face, and they seek treatment to improve their appearance in their own eyes.
Right.
Now, there's a lot of people that say that, Mrs. Jones, she thinks she looks better, but, I don't think she looks better. But it's really in the eyes of the beholder. Right. And if a person is unhappy with their appearance for whatever reason, and if there's a surgical procedure that is safe and it's reliable, and will achieve their goals and make them happy, then I think they're a good candidate. And this requires a lot of examination of their expectations, because one can have a very good result, but if the patient's not happy with it, even though objectively it's a nice result, they're not happy because they were expecting something else, then that's obviously a failed surgical procedure in their eye.
Gotcha. So what exactly is the procedure? Is it pulling the face up, pulling it back?
Well, it's actually, there's multiple vectors that the tissues are pulled. But basically a facelift, generically it's cutting and lifting of the soft tissues of the face and the neck, both the skin, the fat, the muscles. There's different types of facelifts based on how deep one goes into the tissues. There's what they call superficial facelifts, where you're just lifting up the skin and pulling the skin. And then on the other end of the spectrum, there's what they call deep plane facelifts, where the incisions are made down to the bone and all of the tissues are raised up off the bone and pull back the muscle, the fascia, the fat, the skin. And then there's in between, which is kind of what I do, what most people do, where it's like a double layer facelift, where you're lifting up the skin and then lifting up the fat underneath, pulling that back as a separate layer, then pulling the skin over it. And I would say a facelift typically is rejuvenation of the face and the neck. Brow lifts, is some people include that in a facelift. I just call a brow lift something separate. And people can do just the face and not do the neck. They can do just the neck and not do the face, or do both. Because there are a lot of people, when they're starting to age, in their 40s, they may have a little bit of loose skin under their neck, but their face looks pristine, and they just want to deal with the face, with the neck, and then vice versa. So we do a lot of little upper or mini facelifts on that patient group. So it depends a little bit on their anatomy. It depends a little bit on how they've aged and kind of what bothers them.
Okay. You kind of touched on this earlier about managing expectations, but who is a good candidate for it?
Well, first of all, it has to be someone who has a problem that I can see and fix. And there are people who come in who have such minimal problems that to undergo a bigger procedure, it's just not worth it, because they're going to go through a lot, they're going to spend a lot, they're going to have scars, they're going to have a recovery to gain just the smallest amount of improvement. So you have to kind of, now some of those people will go through that. But sometimes non-invasive, smaller things may be more appropriate for them. But I'd say in general, they have to have good expectations. They have to be in good health. They can't be on blood thinners. There's a lot of people taking a lot of different supplements and over-the-counter things that have interactions with our clotting factors, and so you have to be really careful, because bleeding is a big issue on facial surgery. So you have to make sure you're off all blood thinners. And smoking is really bad for facial surgery. So we want anyone who smokes to be have stopped for several weeks, if not a few months, if possible.
Okay, good to know. What does the average facelift cost?
For a full facelift, meaning the face and the neck, I would say around here it's probably $15,000, roughly. A little bit depends on where it's done. I do most of my facelift surgeries in my office, where I can control costs quite a bit, and then we move them over to a surgery center. The costs go up a little bit over there. But I would say for a full facelift, anywhere from probably $15,000 to $20,000 if they're really asleep at the hospital or something.
Okay. Are there payment options available for somebody who wants to have the procedure but maybe doesn't have all the money right up front?
Sure. There are financing companies. The one that we specifically deal with is CareCredit. And we've been very, very happy with this company. And now it's, cosmetic surgery is right out there in the mainstream. people aren't embarrassed to walk around with a splint on their nose or facial bandages. It's something that, everyone can do. And to have a financing company that's as reputable and as flexible and as easy to work with as CareCredit has been very, very helpful for that group of patients.
Good to know. What should a patient look for in a cosmetic surgeon?
I think a couple things. One is their training. There are a lot of people doing cosmetic surgery that are not formally trained plastic or cosmetic surgeons. In my state here, California, the laws are very, very lax, and most cosmetic surgery is done in office operating rooms.
Okay.
And the law here in this state is if you have an MD after your name, doesn't matter what you're trained in, you can do whatever you want in your office operating room.
Wow.
So the burden is on the patient to do a little due diligence and do some research to figure out what is the level of expertise and training. But I would say they need to be certified by the American Board of Plastic Surgery. They have to have been in practice, at least a few years, and they have to, I don't want to say subspecialize, but certainly do a consistent volume of procedures in the area in which that person is thinking about, like facial surgery. Because there's a lot of plastic surgeons that don't do any facial surgery. They do all body surgery. And there are the people who just do nose surgery.
Right.
So you have to kind of do a little research and find someone that you're compatible with and who you're comfortable with and have trust in.
Very important, trust.
Yeah, absolutely.
What should a patient expect to experience during their consultation?
Consultation starts with the phone call. And in my office, you're going to be talking with either Gina or Karina, and they're very pleasant, and even though you don't see them, they have a big smile while they're talking to you. And they're a very critical part of the office because your whole introduction to the office is through them. So it starts with a phone call, then of course a visit to the office, and when you check in, there's a lot of paperwork and things like that. Although actually now we're doing everything digitally and on apps that are given to patients when they call for their initial consultation. But they're kind of checked in, and then they meet with me in the examination room, and I go through a history and examination, and we talk about everything. And once I've answered all their questions, they go meet with my nurse, who is my cosmetic surgery consultant, and she will talk about the financial aspects of the procedure, and if there's financing that's necessary, and how to schedule surgery, and a lot of the technical questions that I may not have answered.
So what are those specific questions that the patient should ask the surgeon when they are at this consultation and they do have your time?
Well, I think one thing they should kind of try to get a feeling for how experienced the surgeon is in this particular procedure.
Right.
So the patient needs to know, what does this particular doctor specialize in, and I'm here for facial surgery, how much facial surgery does he do? And that's one thing. Another thing it's really important is to just be comfortable with the whole office and the staff, because they're going to have an awful lot of contact with particularly the staff. They see me, but they see the staff a lot more than they see me. And then, the educational background of the surgeon. And then asking, what if something goes wrong? What can go wrong, and how do you handle it, and things like that? Because, we're not God. We can't promise 100%, and we can't promise perfection. We try our best, but, everyone is different, and every side of the face is different. And so sometimes there are small little issues that pop up, and they just need to kind of pick their surgeon's brain a little bit about, like, if something does happen, how are you going to deal with it, or how am I going to deal with it, and things like that.
So speaking of those things, what are the risks and complications that are associated with a facelift?
Well, first and foremost, the biggest one is bleeding. The face is very, very vascular, and there's just a lot of little blood vessels. And when you're lifting the skin up, you're, lasering, or we use a laser to kind of zap and coagulate all those little blood vessels. And it doesn't take much for them to bleed. So any type of, if people are on blood thinners, they can bleed. If they put their head down, they can bleed. So I tell patients literally there's like a 5% chance they could have a major bleed that would require, some type of usually it's a small little surgery in the office, nothing big, but that would require some type of a surgical procedure. Men, it's a little bit higher, both because men tend not to be quite as good patients as ladies.
Wow.
They push it a little bit. When you tell them, like, don't put your head down, and next thing you know, they're under the sink trying to fix the garbage grinder or something. But actually, I think it's more related to the fact that they have all the hair follicles in their face, and there's more vascularity in the male face. So bleeding is by far the most common complication. Nerve injuries, very few and far between. I haven't had a nerve injury in 15 years. That depends a little bit on the techniques, what I was describing earlier, going deeper into the face, under the muscles and things, you have a little bit more chance of that. So the way I do facelift procedures, there's very little risk of nerve injury, knowing the anatomy. And smokers are the big problem group. Smokers have a lot more complications in facial surgery than non-smokers, and so we spend a lot of time trying to convince smokers to stop and go through different things to get the nicotine out of their system and get their oxygen saturations back to normal before we do surgery.
Good to know. So can you go ahead and explain the difference between a mini and a standard facelift?
Yeah, so a mini facelift, as the name infers, it's a smaller version of a full facelift. So a full facelift, in my mind, involves lifting of the soft tissues of the face and the neck. A mini facelift is just the face, basically from about the corner of the eye down to the jawline, kind of this area here. And then that can be even subdivided down even further. There are some people who come in and say, you know what, I'm really happy with everything. I just don't like the way my lower eyelids, like me, I have what we call tear troughs, where our cheek kind of sags a little bit. And if you just do a small procedure and kind of pull this up like this, you can kind of correct that little, we call the tear trough deformity, and that can be done through a very tiny little incision up in the hair. So that's like a mini facelift. So there's different variations of it depending on what the person's problem is and what they want to go through.
So tell us how the procedure is performed.
So facelift surgery, the person will come in, there's a lot of paperwork they do in the morning of surgery. I'm not a great person with hair, but I do some hairstyling to get the hair out of the way of my incisions, do some markings, and then photograph all this. And then if we're doing this in my office like I normally do, we give them a Xanax pill when they first arrive. So by the time we're doing all this, they're calmed down. And once I've gone over all the instructions and things and what's going to happen so they're aware of everything, I give them an injection of Demerol mixed with a few other things, and that puts them into a very, very nice, sedated situation. Some people are completely asleep at that point. Most are kind of in and out, and then we bring them back to the operating room, lay them down. My nurses clean them, and then the first thing we do is inject everything, and that's really the only part of facial surgery that they feel. It's the first 5 minutes when we inject all the incision lines and where we're going to be doing the surgery, but they're kind of sedated, so most of them don't even feel that. Then we let them sit there for 15 or 20 minutes and let the injected numbing medicine, which also has a vasoconstrictor in it, adrenaline. So all the blood vessels shrink, the face turns white, and then we do the surgery, and there's very little bleeding. And at that point, most patients are just sleeping through the whole thing. And then at the end, once they're all done, we wrap them up and wake them up, and home they go.
All right. What can the patient expect to experience after the procedure and into recovery?
So the thing about facial surgery is it's it's almost painless. That's one really nice thing. It's very different than, say, a tummy tuck or breast implants, which hurt a little bit. Facial surgery, the person wakes up and they just feel tight, but there's really almost no pain. They'll be all wrapped up, so their head looks like a Q-tip. You just kind of see their little face, and it's all wrapped up in gauze. There's little drains that are underneath, and they don't have to deal with it. It's all just kind of automatic. And then they just go home, and usually they're kind of groggy, when they go home, and then they just spend the first night with their head elevated and ice packs on their face, and I see them all the next day, and we unwrap them and take the little drains out, clean them up, rewrap them for a few more days, and then they take that off at home a couple days later, and then they can shower and wash their hair.
So it's one follow-up visit, or are there a few?
No, so we see them the day after surgery to inspect everything and change the dressings. Then we see them at 1 week, and any visible sutures are taken out at 1 week. So any suture kind of around the ear we'll take out at 1 week. And then they come back at 2 weeks, and what we call the high tension sutures, which are usually up in the hairline or behind the ears, those come out at 2 weeks.
Got it.
And then I usually see them at like 1 month, 3 months, 6 months, yearly. That kind of typical.
What can the patient expect to experience as time goes on?
A little bit of sagging of the skin. That's the thing that we have to always talk about. I would say the number one worry that patients have when they come in is, Doc, I don't want to look too tight. I don't want to look like these Hollywood people that I don't even recognize. And I always tell them, that shouldn't be your worry. Your worry should be, I love how my face looks now, but now over a few months it's sagged a little bit. And it's because we have natural tone and elasticity in our skin. And what happens is you do the surgery, pull everything tight, and then they swell. And when they swell, it stretches the skin out a little bit. And then when the swelling goes away, the skin will shrink, but just a little bit will it's not anything really significant. But I tell them, the patients that they see, or these actresses that they see that look kind of funny and they're pulled too tight, that is not something that happens after the first facelift. Those are usually people who are doing facelifts and revisions of facelifts and redos, and little touch-ups, year after year after year, and eventually you've kind of pulled the skin so tight you've lost the elasticity, and then it's just like parchment paper pulled over like a mannequin face or something.
Wow, you don't want that.
Don't want that, but that's not something that most people should even be thinking about.
It's interesting that you said, so some of those Hollywood actors, actresses, whatever, they are constantly having this procedure done. Is that common, and is it recommended?
Well, I wouldn't say it's common. Maybe in the Hollywood community it's common. A lot of these patients, those type of patients, they're in front of the camera. There's a lot of pressure to look good. If they shop around and go to enough doctors, they're going to find someone who will say yes and do it, and and that can lead to problems, because facial surgery should be very safe, and you should have a very natural result, and you will if you go to a good surgeon with good experience. And you do this the first time, or even 5 or 10 years later, do it a second time. But if you are a person that has maybe a little body dysmorphia, or feels the pressures to look good because they're in front of the camera, and they're doing this consecutively, your body can only handle so much, and there's going to be some aesthetic complications.
So you said maybe they'll have another facelift in 10 years. I'm assuming that would not be the full facelift again. It's touching up, or is it common that people do have another facelift years down the road?
Yeah, it's common to do the whole thing again, but it's not as extensive. You would cut all the same incisions, you would lift up the skin, but obviously there's not going to be as much loose skin then as there was.
Gotcha.
Because people say, how long is this going to last? I'll say, well, it's going to probably last 10 years. But then I'll say, but you're not going to look at 10 years the way you would if you never had surgery. You're not going to go back to where you were before you ever had surgery. You're just not going to look as good as you did after surgery. So we redo the whole thing, but it's a little bit smaller version of it.
What percentage would you say of men versus women are actually having this surgery of a facelift?
It's a much smaller number for men, certainly. I think cosmetic surgery has become more popular with men over the years, just because it's more accepted, and I think there's more pressure in the workplace for both men and women to look younger. But I would say that the hard part about facelifts with men is the inability to hide the scars while they're healing. Women, they just wear their hair down and it covers everything, and so they can look very good within a week or 2 weeks, and most people with a full facelift are back to work in 2 weeks or even less. Men, it's a little bit more difficult. I do a lot of eyelid surgery for men, but I would say for facelifts, probably only a few % of all the ones that I do are male.
Okay, good to know. Well, thank you so much, Dr. Taylor, for all of your insight, and you've definitely educated us, so we appreciate it.
You're very welcome, Amy.
Before I let you go, I'm going to ask you a couple questions in a lightning round, so you just let me know what comes to mind first, okay?
Okay.
Are you a homebody or on the go?
On the go.
Beach or mountains?
Oh boy, that's a tough one, but I would, boy, I love them both.
All right, we'll give you both on this one.
I really love them both.
Okay. Milk chocolate or dark chocolate?
Dark, for sure.
A book or a movie?
Good book.
Good book. Dine in or takeout?
Dine in.
Art gallery or sporting event?
Sporting event.
Flip-flops or tennis shoes?
Flip-flops.
Do you sleep in or get up?
Get up.
All right.
At least I try.
Yeah, I know. We all try. Well, thank you again, Doctor, for your time. We really appreciate it.
Thank you. I appreciate it, too.
We learned a lot about facelifts from one of the country's leading board-certified plastic surgeons. If you're considering a facelift, we hope we've provided the information that you need to decide if you want to take the next step and schedule a consultation. All the healthcare experts featured recommend and accept the CareCredit credit card. Remember, CareCredit is a leading national healthcare credit card that can enable you to get many of the surgeries, procedures, and treatments you want now and pay over time with everyday promotional financing on purchases of $200 or more. CareCredit can also be used to pay for copays, coinsurance, deductibles, and your health and wellness needs. CareCredit is accepted at hundreds of thousands of locations nationwide to pay for care whenever you need and want it. If you are interested in applying for a CareCredit credit card or would like to find a provider in your area who accepts CareCredit, visit us at carecredit.com. And if you found this information valuable, please leave us a 5-star review on the App Store and a thumbs up and share it with a friend. I'm Amy Frina with CareCredit, and I will see you soon.